This is William and he's about 30 hours old, and so we're going to do his first examination. That's important to do in the first 72 hours of life, and it's a top to toe screening. It's the first of many screening that babies have. The next important one will be at 6 weeks with the GP. So we start from the top, work to the bottom. As he's nice and quiet, I'm going to do his heart first. That's absolutely fine. His heart, his lungs and his tummy is gurgling away really well, so all of that is absolutely fine. Look at his colour. His colour is perfect, and as he moves we'll look to check that his 4 limbs are all moving independently and no problems. The shape of his head, it is normal. All the suture lines, which is where the bones of the head come together, are absolutely fine. The fontanelles, which Mum and Dad know is the soft spot, is just nice and soft there. If it's sunken, it can be a sign of dehydration. If it's swollen, it can be a sign of infection. It's important mums and dads see their GP if that's the case. Eyes should be level with the ears, which they are. We're going to have a look in your mouth. We're going to check there's no teeth there. If there is any teeth there, we need those taken out because they're often loose and they can be inhaled, and that can be a real risk, let alone a bit sore for mums who are breastfeeding early on. We've seen his tongue mobility is fine. What we're going to check is his suck reflex now. We can block off either nostril. He continues to suck. Therefore you know that his nostrils are absolutely patent and not a problem. So I'm going to work my way down, look at his neck, check for no webbing, and check his clavicles. We've got no fractures there. Now I'm actually going to go on to his abdominal examination. What we're feeling for is any obvious lumps or bumps or problems. I'm doing it through the vest, so it isn't cold to touch for him. Absolutely fine. Now, what we can see with him, with his skin, is he's got a rash. It's very common. It's a newborn rash. They're inside a nice sterile environment and they come out, they're in contact with our linen and our sheets, with clothes, and so you can get this rash that appears to be dotted around, and so tomorrow you might find the rash is somewhere totally different. It's not a problem. Very, very common, but mums and dads need to be reassured of that. If you look at him, he's nice and symmetrical. His nipple area is fine. Sometimes that can get a bit swollen after a few days, and it's just a withdrawal from mum's hormones. You can also check his armpits, check there's no webbing, any nasty spots or anything there. There's not. Look at his hands, 4 fingers and a thumb, and all his creases. Also check that his fingernails are there. They are. What we're going to check now is his grip reflex, and for any head lag, and he's a strong lad. No head lag that. Lots of head lag can be an indication of poor tone, and we'd want to follow that up further. Just look at the core clamp and check that's drying up nicely. No problems there. If it was red or inflamed around there, it could be a sign and a portal for infection, and we'd get him referred to the doctor. Perfect reflex in both eyes. That's the red reflex, which shows there's no cataracts. We're just going to check the pulses in his groin, his femorals, which also checks the cardiovascular system. They're absolutely fine. We can check his penis, check that the urethra is at the end, check his scrotum, check that both the testicles are descended, and it's important to check with mum and dad that the stream in little boys is really good as well. We don't expect to dribble. Okay, next we're going to do is check his hips. It's important to reassure parents this doesn't actually hurt them, but it is uncomfortable. And he's absolutely fine. Then we need to pick him up and check his spine. Spine absolutely perfect. All the way down. Check, lots of babies have little dimples at the bottom. Check that that's fine, and that you can see the bottom, that you can see the base, and that it's covered with skin, which is absolutely fine. You can see he's trying to crawl already. Over you come again. We sit you up and we just check. And you see that little stepping reflex. That's a reflex that babies are born with. Then it's important to discuss with mum and dad all the health promotion issues, that babies aren't overheating. You talked about them about safe position in the cot, so babies are on their back with feet at the bottom of the cot. Keep them out of smoky environments, and advise them, although their babies are absolutely beautiful today, there are some days when they don't appear quite so beautiful, and it's okay just to put baby down, go and have a cup of tea, and come back. All babies are safe in their cots. I believe he needs a cuddle.